On the afternoon edition, and we're going to take an in-depth look right now at the huge spikes in cases, and we mean huge because as a state, 5,500 new coronavirus cases were reported from the state health department. Here's where we stand right now, about 110,000 new cases, several dozen deaths, and a couple of hundred hospitalizations also being reported. Orange County, take a look at that, 554 new cases. The list goes on with triple-digit increases and double-digit increases as well. Really, again, the only counties in Central Florida with single-digit increases are Sumter and Flagler County. So overall, what do these numbers indicate? We had an in-depth discussion with Dr. Jeffrey Stalnecker with Health First. Sort it all out for us. All right, we are joined this afternoon by Dr. Jeffrey Stalnecker, who is with Health First. Dr. Stalnecker, thank you very much for spending some time with us this afternoon. Good to see you.
Absolutely. Thank you.
So let's dive into the increase in cases that we've been talking about. Alarming for sure statewide, around the country and locally here in Central Florida. What does it mean to you with this increase? What does that say to you?
Yes, back in March and April, we were fortunate here in Brevard County and Central Florida in general that we were spared a lot of the volume of cases that we saw in the urban areas. But I think now, as you're seeing around the country and here in Central Florida, that we're beginning to see it in the sort of next level of communities. It probably does correlate to opening up and how compliant we're being with the recommendations about opening up. Here on the Space Coast, between Memorial Day and the launch of SpaceX, we saw significant crowds. And, my personal observation was many of them weren't necessarily following the recommendations around distancing and masking and so on.
We've seen cases increasing in the triple digits. We've seen it consistently for at least a week in Orange County, where we are. And various other counties have seen triple-digit and double-digit increases. What is it cause for concern?
Well, we're certainly monitoring it closely. We've seen the same thing in Brevard County, about triple-digit increases over the last week to 2 weeks, and more COVIDs actually that we've treated now than we did in March and April on any given day. So we're certainly monitoring it. We're in a good position right now. We have plenty of capacity, and we got plenty of PPE, and we're certainly a lot better at understanding the disease and how to manage it. So we feel much better than we did in March and April, but the cases are increasing, so we're watching it closely.
Tell me that again. That's been an important thing, and that was one of the driving factors of the original stay-at-home and safer-at-home orders, is to control hospital capacity. Tell me that again. How is the capacity, at least where you are?
So pretty good. So yes, the idea of flattening the curve didn't mean the curve was going to go away. It just meant that we were going to be able to push it out to manageable numbers. So where we are, we still have a good capacity in our ICU, certainly a great capacity in terms of hospital beds. Our negative pressure rooms that we normally have in place without doing anything special have still, have capacity, and we have plenty of capacity related to ventilators. We're in much better shape on PPE than we were in March and April, where we had to scramble and constantly be looking and trying to keep up. But in the meantime, we've been able to increase our supply, so we feel good about that. So we do feel right now that we're in good shape, but again, we're monitoring it closely.
Yeah, I was on the PPE topic really quickly. I looked online and saw plenty of medical masks. So there's definitely a far better supply than there was. The cases have been hitting the younger population. I mean, the median ages in a lot of the counties in Central Florida have dropped significantly from when the pandemic first started, and a lot more people are not feeling symptoms, or the symptoms are much milder. Do you think this is a different strain, or do you think this is the same strain that is just affecting people differently. What are your thoughts on that? Your personal thoughts as a being in the medical profession?
Yeah, I think it's more sort of the epidemiology that's changed rather than the virus itself. Younger individuals, again, with the reopening, it would seem, if you sort of look around town, that because they're younger and therefore healthier and less susceptible to bad outcomes, that they're more likely to be mobile as opposed to our more vulnerable population who I think are still being careful. Mm-hmm. So you see more younger folks out. Again, my observation that masking and distancing not maybe being as compliant with that. And so I think that's why you're seeing the uptick in the younger age group. And because they're healthier, they do typically do better. I think it's the same virus that they're getting. I just think that they have the advantage of youth and not having other comorbid conditions that will be a problem if there's infection in our nursing homes or other types of settings or in our more vulnerable population.
We know we've talked about it before time and time again, but it is always a good reminder, because I've heard from several medical professionals who I know personally that have said that this is a very, very manageable virus. All you have to do is wear the face coverings and wash your hands. But tell me that again from your perspective. What can we do? What are the simple things we can do to prevent the spread and bring these cases down?
Well, I always say, you can't really get the virus alone in the middle of the forest. So it's a disease of interaction, as most viruses are. And we've been dealing with viruses for years, influenza and all the other viruses that are respiratory or contact related. And when you follow precautions, some are obviously more infectious than others. But if you follow the basic precautions it is a disease of interaction, so distancing and masking and sanitation and hand sanitation, then yes, it's manageable, just like all the other viruses that we deal with.
Do you think it'll take a vaccine to get us back to a more normal state? I've got less than a minute left, but I wanted to ask you that really quickly.
A vaccine would be a rapid boost, right? We don't have an effective treatment right now. I worry a little bit about people's concerns around getting a vaccine. Some of this has been politicized, but it's a vaccine, I think, that will really get our economy going again and make it safer for all of us, regardless of how much care that we're taking.
Thanks for your time this afternoon, Dr. Jeffrey Stulnicker with Health First. Good to have you. We'll have you back.